Principles of Geriatric IV Infusion Therapy. With the geriatric immune system, physiological changes include the immune system becoming hyporesponsive to foreign antigens, a decreased number of circulating lymphocytes, and the immune system becoming hyperresponsive to itself, which results in resistance to infection. Disorientation, confusion, loss of appetite, and lethargy might be the first signs of an infectious process. A fever may actually be delayed for 2 to 3 days or may not even be present in some of these patients. With the pulmonary system, physiological changes include diminished pulmonary function. And as nursing staff, we also need to recognize that there's some degree of vision and or hearing impairment frequently present in the older client. So make sure that you speak clearly and distinctively and face the patient when you're speaking. In device selection for the geriatric patient, make sure that you use the smallest gauge and shortest length device possible to effectively deliver the ordered therapy. The winged hubbed catheter is especially suitable for the older patient's skin, allowing for better stabilization. I don't particularly care for this model because it's the needle that stays in place in the vein and not the plastic catheter. So if there is a device that has a plastic catheter rather than the needle, then I can see this being very appropriate. With site selection, avoid flexion areas that have bruising, because there's an increased oncotic pressure that can actually cause collapse of the vessels. When possible, again, avoid the dominant extremity, avoid small spider web veins, and avoid the hard sclerosed veins that feel very cord-like. With vein palpation and dilatation, make sure that you palpate gently because aggressive tapping can result in a hematoma due to the fragility of the vessels and tissue. If the patient is hypertensive, you don't need to use a tourniquet. If you do use one, then apply it lightly to avoid overdistension of fragile veins. And the alternative is to have an assistant apply digital pressure with the hand above the intended site and then release it once the vein has been entered. Aseptic technique is crucial with IV therapy, no matter what the age of the patient. So hand washing is very appropriate and proper disinfection of the site. With cannula insertion, the required angle of insertion is over 5 to 15 degrees because of diminished subcutaneous tissue that results in the veins being more superficial. Always make sure that you apply appropriate skin traction below the projected insertion point. The direct method of venipuncture is often the most appropriate. When you stabilize the cannula, consider the skin fragility and use hyperallergenic or paper tape. Minimize the amount of tape used because excessive taping can lead to skin tears in elderly patients. With the dressing, use the transparent dressing when possible because it does aid in stabilizing that cannula, and it also decreases the accidental dislodgement of the cannula. And again, minimize the use of tape on fragile skin. Site protective measures can include, these are generally required for agitated, confused, or restless older patients. Different options can include a long-sleeved gown, hand mittens, a flexible elastic netting that covers the site, an arm board, or a commercially available IV site protection device. With the rate of infusion for the older patient, recognize that the older patient has a lower tolerance to a rapid infusion, so care must be taken to prevent runaway infusions. Make sure that you have an accurate setting of the infusion flow rate. Inaccessibility to the roller clamp, make sure that it's not within a confused patient's reach. And if you use an electronic infusion device, make sure that always try and use a free flow protection if possible. Assessment of the geriatric IV therapy patient should always be ongoing. The risk of complications, if you have a runaway fluid or not enough fluid, can cause significant issues quickly in the older client.